Hey, hello everyone. Welcome to Wellness Wednesday. Hope you all are having a great day so far. And a warm welcome to all of you new ladies joining us today who are new in the group. Welcome. Wellness Wednesday is, I think it's kind of fun because, I get to share, for about 25, 35 minutes, some important information about a topic that I think is relevant and um, is important, right? Especially when we're talking about how we want to get healthier and knowledge is power. And so I definitely want enjoy sharing the things that you know, I think will make a difference for you, okay, in your lives and with your health. So, um, as we wait for everyone to get on, I'll say my disclaimer, and we'll get going with that. All right. So, anything that I say here tonight is just health information and not health advice. Don't start taking or stop taking or change the way you're taking any of your medications. And if you think you need to do that, please first consult with your prescribing practitioner so that they can help you make those changes appropriately and safely. And by attending this Wellness Wednesday, this does not establish a doctor-patient relationship. So here we go. Oh, very exciting. I announced the next masterclass on Monday. Okay. I announced it Monday. So it's my 5-day Fix Your Thyroid masterclass, and I'm really excited to share this important information with you, all of you ladies in the group. I will be explaining my blueprint that has helped thousands of patients, especially women, fix their thyroid issues and reverse so many symptoms and disease processes. Whether you have low thyroid or hyperthyroid or no thyroid, this information can literally be what can change your life. So I'm really looking forward to sharing this with you. So this happens Monday, June 9th through the 13th. All right, June 9th through the 13th. It's every day that week, Monday through Friday. And we go live, same as we did tonight for Wellness Wednesday at 6 p.m. Pacific, 7 Mountain, 8 Central, and 9 Eastern times. And again, every night that week. Oh, and I always throw in some bonus material. So, I mean, there's always so much information that I want to share with you. Register with the link in the comments here so that you can get reminders and stay tuned in and you remember to attend because all too often we sign up for things and then don't show up for the very event that could literally change your life. Okay, so register and I'll see you all there. Okay, I think we're good to go. For tonight's topic, we're going to talk about allergies. So, the conventional knowledge about this is that the immune system reacts to different substances that are typically, they should typically be harmless for us, but instead our immune system reacts. These substances are allergens, right? So things like pollen and dust mites and different foods, of course, pet dander, insect stings or venoms, things like this. So, this is where the immune system mistakenly identifies one of these allergens as a threat, and and then this causes a release of histamine and other chemicals. So, besides histamine, the immune system causes the release of several chemicals to cause an allergic reaction. These chemicals help trigger, maybe even amplify the allergic response. You may have heard of some of these or may not. Some of them are kind of tricky. Leukotrienes, prostaglandins, cytokines for sure, something called platelet activating factor, and tryptase. These are all related to the inflammatory reactions that are associated with allergies. So the swelling, right, the redness, mucus production, even these signal or participate in signaling to coordinate the immune response and then breaking down proteins. All of these chemicals work together, often intensifying each other's effects, which is why allergic reactions can vary from very minor to quite severe, right? So you can have these symptoms, right? Sneezing, runny nose, or itchy eyes, itchy skin, skin rashes, of course, hives, swelling, trouble breathing. And this could be like asthma or anaphylaxis, right? Where the throat closes off. And of course, this is, you may have heard of this or may have experienced this. If you have, you probably know what an epinephrine pen or EpiPen is. And then you can have like food sensitivities, and these are going to be a different sort of reaction. So I'm not going to include these in this discussion of allergies. They're just a very different, they're a different sort of reaction. Okay. So treatment usually consists of avoidance or elimination as much as possible of the substance. Uh, Antihistamines are widely used. I mean, you've seen so many of these in over the counter things like uh, Zyrtec and Claritin and um, you know I want to say fexofenadine. That's the generic for oh my gosh, I can't think of it. Um, anyway, so many of these antihistamines, right? I mean, there's some older antihistamines like famotidine and things of this nature, but um, these are typically the go-to treatments. Benadryl certainly is an antihistamine. I mean, we've heard of all of these, right? Allegra is that other one that I was trying to think of. Um, so we've heard about all these. These are called antihistamines, and they calm down the histamine response, um, or histamine release, I should say, causing the response, to these allergens. Allergy shots, another possible treatment. These are essentially, wanted to touch on these. Let me touch on these real quick. So these are just tiny, gradually increasing amounts of the specific allergen, especially environmental allergens. It's not typically for food allergies, but environmental allergens, including, pollens and dusts, and, dust mites and um, things like venoms, bee or wasp or, one of these types of allergens to help. These are, again, these tiny, uh, but gradually increasing amounts injected to help your immune system to become less sensitive to the allergen, training your body to tolerate it. Okay. And these are often given, well, they have to be given under, I shouldn't say often, they're always given under medical supervision because of a small risk of severe allergic reactions, especially earlier on in the treatment phase. So the problem with this, where it's training your body to be tolerant of it, the problem with this is it doesn't cure it, and it's that the problem is that your immune system may grow to tolerate, but that this is exactly what is meant to be a chronic stressor, or what it means for it to be a chronic stressor for the immune system. So for those with autoimmune disease, this chronic stress just fuels the autoimmune fire. And so many of you with allergies and who have maybe had these shots and noticed they might work, but you still develop other symptoms, other autoimmune symptoms, other problems. And this can often be one of the triggers. Okay. Okay. Then another possible treatment is homeopathy. And And this can be quite effective, actually. Homeopathy in its purest form takes the substance that one is allergic to and dilutes it down in distilled water or alcohol many, many times to the point where none of the substance actually remains in the diluent. Um, so, in other words, if you talk to a classically trained homeopathist, and I have, you're talking about the energy of that substance is still thought to exist in that diluent. And then these are sold as pills and drops or creams. And you might have heard of things like arnica is a cream, homeopathic cream that can help a lot with aches and pains and things like this. And they do help, um, although they're not necessarily supported by scientific evidence. But many people swear by them. And I'll tell you, I know they're effective. Many consider them to be very effective. Um, I can say by past experience that they seem to help my severe allergies to pollen, grasses, molds, and so forth when I was younger. So, funny story, my allergies were so bad that as I was a young teenager, I remember, and I got contacts, and I was out golfing with my cousin, um, and I was just so irritated by the grasses and pollens in the air, and I literally couldn't stand it anymore. I had to take one of my contacts out, and back then, I mean, you didn't think to, I don't know, I didn't think to have something with me to store a contact in that I would normally have in my eye. And I had to put it in my mouth for the rest of the golf game to keep it moist, and because they're expensive, right? So here I go trying, golfing the rest of the game. I golfed like, I don't know, like four or five more holes with this contact in my mouth. Uh, I think you can, probably surmise that I didn't do too well for the rest of those holes. But yeah, it was super inconvenient, right? It was just awful. And as I went through that treatment with the homeopathic remedies, my allergies got better. And I don't deal with those today. I know part of it is that I've worked a lot on my gut. And I'm going to talk about that in a minute. But um, I don't have those reactions anymore. I'm not bothered by grass, pollen, not at all. Now, I think there can be some problem with homeopathics. They won't be as effective for food allergies and should not be relied on for allergies that have caused anaphylactic symptoms for sure. So, um, yeah, you do have to be mindful, but I think they're worth a shot if you are dealing with allergies. And they really won't address the root cause of the allergies. So they're still a band-aid. They're still just a treatment to, you know, treat the symptoms, cover them up. So, why do we develop allergies in the first place? And um, leaky gut is a term we practitioners use when the lining of the gut or intestines, right, becomes more leaky or porous than normal. Normally, your gut acts like a filter, letting in nutrients, but keeping out harmful stuff like bacteria and toxins or partially digested food. So when the gut lining gets damaged or inflamed, right, tiny gaps can open up. This allows things that aren't supposed to get through to slip into the bloodstream. And your immune system sees those substances like food particles or bacteria and may treat them like threats, right? This can trigger an immune response and stimulate what we call the enteric nervous system, which is essentially the vagus nerve, okay? Not the Las Vegas nerve, but the vagus nerve, and send signals to other areas, okay? Which can then lead to allergies, where your body starts reacting to harmless things like certain foods or pollen. So this is where when you have leaky gut, this can lead to uh, allergies and asthma, right? This can also lead to skin reactions, which these are essentially allergic responses. So eczema, hives, this is why this happens. And we know there's this connection. Even headaches, migraine headaches can be an allergic reaction to some of these things. But like I said, um, we don't want to get this confused necessarily with food reactions or food sensitivities, but there's a kind of a blur between these, right? There's some overlap. So in short, leaky gut can, definitely lead to an immune system activation, causing it to react to stuff that it shouldn't, right? Which can lead to allergy problems and even autoimmunity. I should mention that. You know, autoimmunity starts in the gut this way in a very similar fashion. Now, another cause of allergies needs to be considered. That is parasites. Parasites are mediated by eosinophils, a certain type of our white blood cells, which is a part of our immune system. When we are exposed to and then we start to react to parasites, eosinophils increase in quantity. As a marker for this, and the blood test can show, okay, in response, and this eosinophil increase is in response to the worm's activity in our cells and tissues. When they're finally getting the attention of the immune system, and they can be in the blood as well to get this, to promote this reaction or this response. And of course, they have a large presence in the gut. All right. So it is these eosinophils that also mediate allergies. Okay. So when we have, or sensitivities too. And so when we have a parasite load, it is thought that because of this response, it will decrease the threshold for reacting to whatever substance you're reacting to. And also because the parasite cells are similar to our own cells, the immune system can confuse them with ours. And this can also lead to autoimmune issues as well as other chronic degenerative conditions like even diabetes and cancers. So we have seen that by treating parasites, patients' allergies improve. So just the other day, I heard from a patient, Lily, who told me her allergies were significantly improved after going through her program, where we addressed her leaky gut, mold toxicity, and parasites. Mary is another one another dear patient who had parasite markers. And after treating those, her eczema and allergies resolved. Many who have been on allergy shots no longer need them or you're doing much better even without taking antihistamines. Another patient, Todd, works as a mail carrier and was having what's called cold urticaria, or in other words, a hive reaction to cold temperatures. Obviously, his immune system was really confused, right? So as we treated his inflammation, his parasites, detoxed him from several things, including mold toxins and so forth, his cold urticaria went away after having it for years. Okay, so allergies, they're not normal, obviously, right? We shouldn't be reacting to different things like this. So substances, I mentioned cold temperatures, and they can be certainly disruptive and very inconvenient symptoms, right? And so when we find and treat the root causes, we find that we can actually see these kinds of things improve. And for many of us, they're like things that we're just kind of used to, and they don't necessarily reach the top of our priority list when we're thinking of symptoms that we'd really like to, resolve. But for many, they are a bugger, right? For many, they are so bad. And I know for me, when I was younger, that's why my parents, actually my parents couldn't afford the care. My grandparents helped my parents take me to this homeopathic doctor out of state to, you know, help me with my allergies because they were so awful. Um, so yeah, when you find the root causes through the proper testing and the right evaluation, then we can help these kinds of things, and they don't have to be the the uncomfortable symptoms that they are for us. So, all right. Well, I was hoping, or I was planning to go ahead and open this up to some questions. So let's see what we've got, if we have any. All right. So Denise asks, I get swelling in my eyes some days more than others. Difficult to know what is causing this and what to do. And so, yeah, the swelling is going to be that allergic response to something. Now, this can be to those parasites. A lot of times, eye swelling, like I don't know if she's referring to like this in the eye or if it's under the eye. Like a lot of us get um, these like bags under the eyes, and and I'll tell you, mine have been a lot worse, and I still do have a little bit. So I think maybe, well, maybe these allergies or things aren't completely resolved, but um, yeah, that could be definitely allergies, uh, and that's probably what's going on. And some days they are going to just be worse than others because, like I said, there's a threshold that your immune system reaches. And and I talk about this a lot in the master class about autoimmunity, how you'll have you'll have symptoms that come and go, or that that cycle, because your immune system's getting triggered more than on triggered more some days than others, right? Hold on. So that can account for the variability in these reactions. Okay. And she also asks, is it okay to take antihistamines occasionally? And what adverse effects can they have? So I don't think occasional antihistamine use is necessarily a bad idea, as long as you're not relying on that necessarily for uh, relief, or get complacent with these symptoms. Please pay attention to these symptoms. They're happening for a reason, letting us know that something is stimulating the immune system, and that's going to trigger the immune system, especially when you also have autoimmune disease that you're dealing with. And so you definitely want to find out a little bit more about what these allergens are, or what these, the food sensitivities are, because that will also play a role in triggering this autoimmune response, and the damage that causes. Margaret asks, can local honey help? Yes, watch out for glycemic overload. Yeah, that's true, Margaret. So yeah, unfortunately, if you have, insulin resistance and maybe even diabetes, then local honey may not be the best thing. It can, because it acts sort of like um, it acts sort of like those shots act. It just has very small amounts of the pollens from trees and grasses and things like this, not necessarily, you know, or flowers or things like that you're allergic to, not really grasses, but yeah, kind of. Um, Not to get into a huge amount of detail there, but so it's kind of like inoculating yourself with these very small amounts of the allergen. And so, yes, those can cause you to be less sensitive or more tolerant, like I said before, over time with your immune system. But again, that is not necessarily fixing the problem because even a tolerant immune system is a stressed immune system. Okay. Danny asks, what about face swelling all around CPAP? I wake up with a swollen face every day and wonder if it's what's in my nose or what's in my body. Well, this just means that there's a fair amount of water retention in your face, and the CPAP simply just displaces that. And so it's not causing the swelling. The swelling's already there from something else. Okay. That can be from immune dysfunction, yes, allergies. This can also be from adrenal dysfunction, low thyroid, right? These are definitely possible causes of that facial swelling that is simply displaced when you have the mask over your face. Okay. Those are good questions. Do I see any more? Let me go to the comments if I can grab some myself. I think we've covered all of them so far. Um, so, and if you have any other questions that you think of after this, put them in the comments. As we are preparing for the masterclass, my staff will be compiling questions. And so if you've attended the master classes before, you'll know that I do a live Q&A at the end of each class. So this is often the most popular session because I go rapid fire through your questions and answer a ton of them. And they're going to start compiling your questions these next couple weeks. So if you do have other questions, feel free to put them in the comments, and I'll definitely address those as I can. I'm still working on questions from the last master class as I jump in live each day, to answer questions and to share information that I think is relevant to share at that day or whatever. So yeah, put them in the comments. We will be compiling them so that I can do a live Q&A at the end of the masterclass. It's really important that if you are struggling with your thyroid issues or symptoms, you may not have a thyroid issue. Maybe you think you have a thyroid issue, but you have weight gain, you have in fatigue and tiredness, you have brain fog and trouble concentrating and short-term memory issues, or you have menopause symptoms, all right, which you have to understand. Menopause is not a disease, and if this is the first time that you hear that you're hearing that, let me repeat that. Menopause is not a disease. And there are root causes for you having these symptoms. And I'll share with you why these are not all in your head. You're not making these symptoms up, ladies. I know you suffer from these. A lot of you really do suffer from these. And some of you just have these symptoms that are annoying you. And you're not necessarily letting it get to you, but they are there and they are annoying you. And maybe for some of you, they're getting worse and worse. And no matter what you do, no matter what you read and try to implement in your as you're going through this health journey, you're not gaining any ground. They're getting worse. This masterclass is for you. If you have no thyroid and you're wondering, well, why are you still having symptoms? You thought that thyroid replacement hormone would fix it, or you thought that getting your thyroid out would fix the problems that you were having, and it hasn't. Well, because likely what was causing the problem in the first place was not addressed. And by removing the thyroid alone, that doesn't fix the root causes for why you were having the symptoms in the first place. And maybe it wasn't thyroid causing those symptoms. So I'm going to show you what testing you need to find out what's going on. Find out how you can achieve a comprehensive diagnosis and then be able to find out how to address these issues the right way so that they actually resolve. You know, the the information that has helped so many patients, right? And many patients still like to attend these classes because they learn more and more. And I definitely encourage you, if you are a patient listening tonight, if you haven't kept attending these master classes, to do so. You'll learn something new every time. I always share new information, and it may be, just what you need to hear to get to the next step that you need, um, the next step in your health. So, um, register. The link is in the comments below, and uh, you know this could be the very information that's going to change your life, literally. So I'm looking forward to sharing that all with you. I'll see you next week for sure for Wellness Wednesday. Not sure of the topic yet, but we will have an awesome topic as we try to do. And thanks for attending tonight. Thanks for attending Wellness Wednesday. And remember, have hope. Have hope that there's a way to find your root causes. All right. There are answers, ladies. Remember, you still have the power to heal. All right. Have a great night, everyone, and we'll see you soon.